So those are part of our roles and what we are expected to do after our learning today. And also we have to ensure that there is proper documentation of everything. Because if we have trained like 10 VHTs, Sharon has trained like 10 VHTs. These VHTs are expected also to train more mothers and caregivers and also VHTs. But if they do not document how many caregivers they have trained in a week, or in a day, or in a month, that means that there is no work done, because we cannot take verbal information that I trained. They have to document. We also have to document. We have to, we shall see that we have to set up counter books where we shall be recording all these people who have trained, the number of caregivers who have been trained. So we have to follow up to see that documentation is made. If there is no documentation, that means there is no work done. So briefly, those are the roles as health workers and what we are expected to do after this training. Thank you.
Thank you very much, Paul. Paul will be coming over after this session. The next session we are going to is the practical session of how do I plan the training for the VHTs. So in this practical session, we are going to meet our expectation. Almost everyone is expecting to learn how to assess for malnutrition. So in this practical session, we are going to learn also how to assess for malnutrition. What do we need to plan for the training of VHTs? First of all, we need the knowledge of the assessment. We need the equipment the VHTs will use. So, and we also need to know, really, what is malnutrition? Can any one of us describe or define malnutrition in your own understanding? Remember, we have different levels. We have the medics, and we have us, the support staff. So any volunteer, what is malnutrition? You're also going to pass on what is malnutrition. You're going to ask us, what is malnutrition?
We can connect.
So Sharon,
straight to him. This one takes in, it can take AVR and put shade.
Sharon says that what doesn't have enough nutrients. Can I have this starting? How do you understand malnutrition? And back in your mind, ask yourself, how will a VHT understand malnutrition?
Yes. It's that stage when the food items are not easy to control. That stage when food doesn't seem hard enough power for subject. So it's the stage.
So Mr. Chimumbi says it is a state, if I can summarize, that results from when a body doesn't get enough nutrients. Yes, can I have Lynn to summarize all the participants to bring us together in the malnutrition? How can we define malnutrition?
Well, malnutrition is a condition where one can either have an inadequacy or an excess of nutrients. So malnutrition, the word mal simply means bad or not right. So it could be over-nutrition, like overweight, obesity, or it could be undernutrition where you're taking in less and we have wasting. Thank you.
Thank you, Lord. Let's bring it down to our programs that we have. In Uganda, treatment that is there is for nutrition. And in our community understanding, we understand that a person is not taking in the right nutrients and they are getting malnourished. And we are looking at the side of undernutrition. Are we together? We look at the side of undernutrition, and in the understanding of our community people or our village health team, we talk to them in a way that these people are not getting enough nutrients they are supposed to get in the body in their right quantities. I can put it in the right proportions. I can put it in Uganda that malnutrition yendwadde eva mundisa entatuukiridde. However, back in our minds, we know that there are other causes of malnutrition. For example, we have another immediate cause of malnutrition that is not only food and it is disease. That is why we are going to integrate management of malnutrition into also the daily other diseases that we have been managing as health workers. So when we are speaking to the VHTs, we shall explain to them that yes, malnutrition is caused by inadequacy of the right nutrients that the person is taking in or is being absorbed, but it's also can be caused by disease. Other diseases, for example, like diarrhea, a disease like cholera, a disease like COVID, a disease like pneumonia that affects the absorption and utilization of these nutrients that we are taking in. That is a brief intro that we can give the PhDs to understand what malnutrition is. And to the caretakers, they can just talk about what day and how these are entatuukiridde. Are we together? So after explaining what malnutrition is, we go to the step that we wonder, how do I see this malnutrition? How do I assess for malnutrition? In the family map concept, we are going to use two ventures. We use for assessment, we are going to use assessment of edema, and also we are going to assess wasting using MUAC tapes. Okay? When I talk about MUAC tapes and MUAC, I refer to a mid-upper arm circumference that will help us check for muscle wasting. So, before you go through all the practical sessions, that we need to know how does this person manifest physically on the body. Can I identify this malnutrition? Please help me with your tool. We have a job aid that we shall be using throughout us as health workers and also the PhDs and also the caregivers to other caregivers. In this job aid, can any one of us, we all have these job aids, help us identify the signs that are appearing, the signs of severe acute malnutrition that even a layman person in the village can easily see and tell us maybe omwana waffe alwadde endwadde agudde mu ndiisa etatuukiridde. Yes, doctor. Signs of malnutrition. You have edema. He's saying we have edema. And how does this edema look like?
Manifests with swollen feet, that's in grade 1. Swollen face, grade 3. Grade 1 is the feet only, and then grade 2 is the knees and the lower limbs, from the knees downwards and the lower and the upper limbs. Then grade 3 is the whole body.
Thank you very much. In the community, let's say for example, among the Baganda speaking, they'll tell us omwana akoze azimbye. But omwana oyo azimbye, when the child is swollen, that edema we are talking about, the nutritional edema should be by NATO on both sides of our limbs. Let us not get confused with this. Because I may be pierced by a thorn and I swear, on one side of my limb. Or I have another medical complication and I swear. This swelling of edema, the nutritional edema, should be on both sides of my limb. As you can see from our chart, our simple job A. You can see from this chart. Can you all see from the chart? Can you all get to our charts? So this is the edema we are talking about. The swelling of the body on both limbs. And it starts all the way from the breathing. By the time I get here, I have generalized edema. So we have another category of manifestation. Do you observe another category of manifestation on our chart 1? She's saying what there is comma on child number 1. Okay, we can have 4. Can you?
I just wanted to actually make a remark on the edema because as health workers, we are going to be teaching or training people who are under us. So we don't need to make it so complicated to them when we go into the training. We just have to teach them how it is and how it can be assessed. It is bilateral pitting edema. So it is on both feet. So they have to test for that. That's what they have to understand. The grading as health workers, we should know, we are expected to know. But when we are delivering or training to the other people that are below us, we give them the simplest information they can understand.
Thank you, Paul. Thank you so much. So we simplify the message to them, to their level. So we have another child, another manifestation. So what Paul is saying, we are going to demonstrate on how to check for this edema. Thank you, Paul. I'll call you on that we are demonstrating it. Thank you. So we have another manifestation of malnutrition, acute malnutrition, which is wasting. And in the olden days, we used to call it marasmus. And this child will be irritable. This child has ribs. So now, when I see all these signs, I cannot come to a conclusion that I am malnourished as a community person. We need to take up these 2 measurements to confirm. Remember, in our communities, people even have prevented malnutrition in France. So as technical people, we need to have something that has evidence to really confirm that this is malnutrition. And I told you earlier, we are going to use 2 methods. We are going to check for wasting using the mid-upper arm circumference and edema. So how do I check for edema? How do I really know that this is nutritional edema on a child? Dr. Pro, please take over the floor and show us how we can teach our VHTs how to check for edema.
So we are making an assumption. This is the 2 feet of this child. So you have, as we say, nutrition edema should be on both sides of the feet. If it is happening on one side, that is not nutrition edema. It should be something else causing the edema. So when you have the child at your disposal, you go down to their feet after explaining to the caretaker what you are going to do. Don't just jump on someone's child before explaining. Explain and get consent to move on. So after we assume we have explained the caretaker, and then you go down to the feet, you have to use your thumb, your big finger, regardless side to examine. So you use them like this, and then, yeah, you see, turn, right? Yeah. So then you go down to both feet, and then you press. You have to press at least for 3 seconds. Not pressing too hard to cause pain, but you press with softness so that you examine well. So when you press, an animal's feet will leave a depression after the 3 seconds. You count, we have a way of counting. You count 1001, yeah, 1002, 1003. After that, it will have you will have completed the 3 seconds. Then you release. After releasing, if you can see, I don't know if you can see, but you will see a depression like this on both feet. Yeah? This is where I placed. So you will see a depression of that kind after those 3 seconds. That will confirm to you that this is pitting edema. If it is happening on both feet, it means it is nutrition edema. So that's how basically you assess for edema as far as nutrition is concerned. You use both the thumb and then you press for 3 seconds as you count 1001, 1002, 1003, and then you release. When depression remains, that is a sign of severe malnutrition. So then we go on, just 5, this child aborted. Thank you. Yes, sir.
Before you leave, additional colleagues, as we are going through this as social workers, we need to first have the messages from VHTS. Yeah? So at the beginning, as you're going to interact with the caregiver and his or her baby, we need first of all from the beginning to differentiate from nutrition edema from non-nutrition edema. There are 4 key points when we are dealing with nutrition edema. Colleagues, you remember that nutrition edema begins from the lower limbs. That's very important for the VHT to grasp, because we can have edema from an insect bite and hypersensitivity, or from organ involvement. So nutrition edema begins from the lower limbs. It is bilateral, meaning it affects both sides. Then it leaves a depression when thermal pressure is applied. So, unfortunately, it does not change with posture or time. So if we have an organ involvement, like in cases of kidney involvement, okay, where someone begins with edema from the upper side, the upper limbs, the face, etc. When the time changes and the posture changes, this edema resolves. So for our message to the VHTs, those 4 key points, so that we know we will rely on nutrition what? Thank you very much for listening.
And also maybe I can quickly compliment this. As the health providers, we are taking it through as the trainer of trainers. And also as the skill providers in assessing regularly. That's why we have talked about this. But also now as trainer of the VHTs, or members of VHTs, so this brief handout which you have received is to ensure in your head or you have the knowledge of the process. So that's why we have already, in terms of understanding the purpose, so that you can quickly share that in words to the VHT, but also to yourselves. Then also your in terms of the where to maximize in terms of screening for at a health facility. Then and also in terms of the outreaches. Then in the interest of time, quickly manage the time, because you remember you don't want to keep VHTs for long, and you also don't want to keep the caregivers for long, just as we already got pressure to see that you go to the VHTs, so that and and whatever they have done a good job quickly tease with the VHTs or the health providers what they know about so that you have prior knowledge, you have to quickly get it or engage, interact with them. You want to make it participatory. So that was very good. Then you now quickly, you of course you have the welcome remarks. So if you follow this in terms of understanding how you flow on page 5 of your manual, welcome remarks, then briefly, what is what? Malnutrition. You want also to make it as brief as, then thereafter, how to recognize what? The signs of what? Malnutrition as we are going through. Then what? The difference between those who have edema and those who don't what? Have edema or swelling or what? Feet. And that's what they're going through, so that quickly they're able to what? Then thereafter, in terms of why what? This family map, the following on 26, then how to check for what? The 3 steps in family map as we are going to go through, so that you quickly able to what? The VSC is empowering them, just as we do. Then how to check for what? Edema, so and mark. And then thanking the caregivers for the VHTS and when it what? To come back. And I'm assuming that for you as trainers and what you already have this in your what? Head. And then most of the time, you're able to have this funded so that you're not having a lot of dotages, a lot of what? Much of the time, you're able to use this what? Of aid. Actually, with the VHTS and what? And then after those remarks and what you are able to quickly say, you're now going to go through how to identify malnutrition in terms of signs, then how to measure, and then how to interpret or classify, and then what? The actions as the teams are going to what? Quickly go through. Then, of course, now what? In terms of prevention. Over to you. I just wanted so that we have a picture in terms of managing what? Time, because that will always be what? Over to you.
Thank you, Doctor. So another way to assess malnutrition is using the motive, and we are going to check on the mid upper arm circumference that shows us wasting. So this is the mark plate. Everyone has seen this mark plate. So on the 3 steps that we go through, we first locate the upper arm. Then we locate the midpoint where we are going to check for where we are going to place our mark plate. Ready for me? So how do I locate the upper arm? The upper, for the VHT, for us, the medical people, you know how to get the upper arm medically. But for us, the VHT, the community workers, we tell them to hold the hand at 90 degrees. So that with this, Dr. Paul, Come on, demonstrate together. Please demonstrate with me.
As we see, this is our 0 point. This is where we start. The 2 arrows indicate that 0 point where we start from. So this point, these 2 points, when you are measuring, you have to first identify the midpoint of the upper arm. Yeah, that is why it is referred to as mid upper arm circumference. So you have to first identify that point, and then by identifying, you bring your tape with these 2 arrows at the, what is this bone called? That fruit,
the lateral border
of the acromion process. So as health workers, I think we know that. So you have to make sure that it starts from that process. So you identify by palpating. So for the this is this part, but it's around here. So you press, yeah, you bring them. Yeah, so as he brings that one, so you put it at that point, at that process, and then it goes down up to the, what is this process again? olecranon process. So up to this point. So from there, you identify the midpoint, and then you rotate your MUAC along the midpoint. Yeah. But this is not for our side, so of course we don't pay. But we are bringing us a baby, so we shall demonstrate better with the next with the real.
So our baby is coming in.
Yeah, however, is new. One is new, and second is not having the mother, so the mother left her in the house. No. So this is a VHTS who has just brought a what? The baby from the house. Yeah.
So we are going to explain how what we are going to do to the mother. The child. So put a man here. Where are the people who are looking from the man on the floor? Genda kusomera ku mwana ono tulaga engeri gye tumupimamu okusobola okumanya nti omwana ono ng'alwadde endwadde ey'endiisa. Kakati nsaba bambi maama onzikirize nsobole okupima ku mwana ono. She has accepted us, she has consented to what we are going to do to that child. So this season is COVID. We need to minimize on the stress. So mwana ojja mutuuza atubeera. This is our lovely baby, and we're going to measure with about the leader kozesa omukono gw'atatera kukozesa nnyo.
Although, as she often is that, although for mothers or caregivers, for us the health workers, the emphasis is normally the less dominant what? But when you are training family caregivers and what have you at that level, you don't need to be very strict that you have to use the what? They can use either arm, and research has shown that even in other programs, so we don't need to be very strict that you must always one use one what? Let the caregivers, as long as they have learned the skill how to what? Whatever arm they what? They use. Are we together? Okay.
So this is our child. I want to locate the upper arm, so I'll make the child fall. And I'll look for that. So this is our 0 point. So I'll put it at the 0, at the tip of the bone. Then I bring the MUAC tape down to the tip of the elbow. And her measurement is 14.5. So someone help me get the midpoint of 14.5. 7.25. So I will mark at 7. At 7.5. So I remove the MUAC tape and make the hand free, and I bring this tape, the MUAC tape, at the mark I have taken. Remember, we have 2 windows on the MUAC tape, and we need to be at eye level with where we are going to read the MUAC tape, and the tape has to be facing, the numbers have to be facing upright. So I'll bring the tape around the arm, the midpoint that I've taken, through the small window. The small window helps us to either tighten or loosen or fit. So in taking MUAC, we need to the tape has to be just fitting, not too tight, not too loose. So we read at eye level, and my measurement here is 11.7. To the VHT level, 11.7 centimeters. To the VHT level, it is in yellow.
So for our VHTs, we don't need to tell them the cut points. We just have to train them on color code identification. Yellow, green, and red. So for you health workers, of course, you have to know the cut-off points, the necessary cut-off points.
Thank you very much. So this is how we assess from work. We check from work. Then after checking from work, we need to classify. We need to grade. Our work test has three categories. We have the green, we have the yellow, and we have the red. Remember, the green, the green, when we are using work, we can refer also to our chart. We can look at the traffic lights. We will normally set the put out there. The child is well via nutrition. The child is not yet suffering from acute malnutrition. Then yellow, the child is having malnutrition. Okay? We shall further, when we go into our mentorship, we shall further talk about the cut-offs. Then when we have red, the child has severe acute malnutrition. Yellow, the child has moderate acute malnutrition. And we as health workers, all our health facilities can manage these conditions. How? At a health facility, you can give health education. Currently, we are having our 3 facilities in Kampala that are managing acute malnutrition. We have Mwana Mujimu, we have CFU here, and we have Kawempe. So when we identify these clients that are in yellow, that have moderate acute malnutrition and have severe acute malnutrition, we need to take action. And what is this action? The VHTs will refer to us as health workers. Me as a health worker, if I receive this child as assessed at the health center, I have to start this child on treatment. And there is appropriate treatment to every child as the chart goes. What is the appropriate treatment currently for children that are having moderate acute malnutrition? We are giving health education and counseling. Not so about? Yes. Now we have the category of the severe acute malnutrition. And we are also managing them. We are not leaving them in the community, and we manage them with ready-to-use therapeutic, treat, and other medication that when they have any other complications. Thank you. Yes.
I think I wanted to add something before we leave the stage. I think what we are doing now in the classification, that is for the purpose of the VHT. But for the purpose of this child, we need to go for further assessment. That is now for our health what? At the health workers. We go for height, we go for weight. Otherwise, if you send this child home for health education and so on, in the field it's going to come back when it is severe now. And you find when this child is already what? Severe, they want to what? Wait for them. Then it's go out. So the next step after that, marker yellow, which is almost red. You see 11 point something is almost what? It's almost red. So what we do, we go for further what? Assessment. You check the child this way when he is having nothing like a cloth, head of clothes, and then you check the real exact height. So that you can clearly classify what? Before you come to conclude that this is it.
Thank you very much.
Thank you.
Thank you
Thank you very much for your guidance and what you are doing at through. And thank you for the man who accepted to bring us a child. Yeah? One, you know we are doing the TOT for health workers. Of course, we shall be mindful for health workers to expose our baby. Okay? You know, when I'm doing TOT, all these things we must have them. Then two, I think for the benefit of health workers, we are not going to leave it at this. Very good for the VHT consumption. But as Kagwa says, beyond the red, the other parameters, very good emphasis. And also, I will also request you later, because we do not have time, you will have to share with us, the health workers, those different cutoffs. We need to remind ourselves in line with the standard revised guidelines. When we are talking about grade for health workers, I'm talking from experience. What does it mean? Because there is no disjoint. These red clients are going to end up in our health facilities. How do we move forward? If we have a clinician or nurse at CFU and the child finally lands here, and of course this team, your team and I will not around. So we really need quality care. So that at the end of the day, this activity has three objectives. We have an objective on prevention, we have an objective on early detection, and an enabling environment. But finally, at the community level, if that case has been isolated and has been brought to the health facility or managed it, we do not want relapse and deterioration, so that malnutrition is improved in the
So today we are just doing a brief so that the health workers can be able to train the VHTs, and we are being as low as to the level of VHTs. But moving forward, everyone at their health facilities, we are going to continue with doing the mentorship, okay? So Matilda, thank you, that was already in plan. So when I have assessed, when we identify the VHT has assessed and identified this as MUAC, their responsibility, once they need to refer this child, they don't need to leave it in the community. That is the I in the P, prevention, identification, and treatment. They identify and refer for treatment. Besides identification and referral, we need also to cancel them behind your chart. We have components. We have components that go alongside with treatment. We have to talk about the feeding practices, how they are feeding the child. That is a part of prevention. And when we are talking to the VHTs, as they identify this, they put into consideration that yes, you identified me as normal, I don't have malnutrition, continue to counsel me on the feeding. Yes, thank you very much. So as we identify these different categories, yes, I am green, but continue to counsel me on feeding, okay? And we use this behind. We have information behind here. So the same to the mouth, the same to the sound that you have referred to hospital. Thank you very much. That is it. Then you have question to summarize.
Thank you so much. I'm not going to summarize, you already given it and we are far behind time. But the most important thing is, let this and those two things that we have given us be our Bibles. Here they are just snapshots there. Please let us interact, let us learn to refer to this, let us learn to follow this. Even those two aids that we have already given us. Thank you so much, Eva.
Yes, sir.
Yes, sir.
Let us also emphasize one thing in terms of
Yeah. You can pick it out. You can emphasize it. Okay, it's okay. Yeah. The point that we want to really bring out clearly is that we do not take MUAC, we don't use MUAC in somebody who is a matters. Okay? Yes, we do not use MUAC in somebody who is in matters.
Maybe.
Yes, let me add something to say.
Yes, I wanted to ask maybe Professor or you guys, when I look at the back of this particular chart, I noticed some differences from the previous one. And the main difference I'm noticing is the cups. Why are the cups inverted? Maybe we should actually know that. Why are these cups inverted this time around? So Professor, is it an error? Oh, I thought they are trying to emphasize that the consistency of the forage. I don't know.
Yeah, it's a very good question. I think what is being emphasized is the level of what? The level of because you can see there's 1 plus what? 4 plus 1 plus 2 and depending on the what? The age in terms of rescue, in terms of proportion, and in terms of frequency per week. So in a brief, what it means, we need to understand it properly. To explain to the VHTs and what? Yeah. What was it before?
Before they were upright.
Before they were upright?
Yeah, they were upright, and you still get that quarter, you get half in an upright position.
Yeah.
So when I looked at it the first time when I came here, I thought maybe they're trying to emphasize this time the consistency, but the consistency is still emphasized on the spoon. If you look at the other side, so I'm wondering.
That is under the serum. It's under the serum that can hold and
Yeah. So that's a good point. We can clarify with the team before what comment this. But at the moment, we'll use this in terms of explaining the importance in terms of what either consistency. We can agree what you need to deliver to get this or what.
Consistency.
Yes.
There's one
Unique one. Yeah, there's an
So we need to really find out whether it was angular or something that we need to emphasize.
Yeah.
Otherwise, we are far behind. We thank you so much for that time. I think we can stand up, stretch a bit, and then I call upon Dr. Nick to give us an overview, a snapshot of the package for the VHTs on common illnesses. Because this, remember, we said this is an integrated activity, and then if we have managed malnutrition, we are not going to look only at the feeding, but then there are other conditions, other illnesses, other diseases that are still leading to, which are called immediate causes of acute malnutrition. So, Dr. Nick, you are most welcome. I request us to stand out, stretch a bit, maybe in a few minutes, and then take some time. You can stand, stretch a bit, and yes.
Good morning, everyone. I welcome us again. I'll just speak very briefly the common illnesses some of these children they present. If they're there with me between 10:05 and 10:30, common illnesses would be HIV and TB. We have diarrhea, we have pneumonia, we have fever. So what we'll look at are some of the signs, some of the home remedies we can offer to these children, not just when they are here, and what some of the things that can be done even while they are at home. Now, one thing we have to have at the back of our minds is that for the fact that these children are malnourished, we may not see the classical signs and symptoms as presented by children who are not malnourished. So one of those, if we look at issues of HIV and TB, in most cases it is it's one of the things that push these children into malnutrition. So it's a must that we have to screen all children who are malnourished for both HIV and TB. We only have diarrhea and pneumonia there. At times, some of these children may come when they're already having diarrhea. Some of them may develop diarrhea as we try to rehabilitate them. So we only have to appreciate how to identify, how to manage them, different from those who who are not malnourished. The issue of fever, not all of these children may come with fever because malnutrition itself puts their immunity down. What makes our body to be able to have fever, that temperature and all those reactions, is a robust immunity, which is compromised with malnutrition. So when that happens, we may not really get a high temperature among these children who may come to us with malnutrition. So we have to have that at the back of our mind so that we don't chase after a ghost fever. Okay, we don't just feel like this temperature is normal and then this child may not be having any problem. We have to know that one of the factors that makes our body develop fevers are our immunoglobulins, which are proteins. In these children, those are lacking, those are low. So we are unable, or they are unable to mount the expected fever as other children who are not malnourished may have. So if we're talking about diarrhea, for example, as a starting point, basically diarrhea tells us someone passing more than 2 loose, watery or bloody motions of stool within 24 hours. So it's very important for us to always find out from these mothers, from these caregivers, caretakers, the number of times these children pass this stool and also the consistency. We need to know if we have any blood in it, if we have mucus. We need to know the quantity, whether it's foul smelling or not. We also need to know whether there are visible worms in this stool or not. It's going to help us because if we fail to appreciate the medical bit of it, we may fail to rehabilitate these children. Because if there is a medical component to it and it's not taken care of, even if we continue to give them this supplemental kit, we may actually fail in rehabilitating them and reaching to the point of discharge. So we may find out that these children may continue to deteriorate and develop other complications which come with malnutrition. In the case of pneumonia, basically we also have to change the misconception whereby in the community you have people saying pneumonia is always caused by excessive coldness and all of those things. But for the purpose of medical management here, as clinicians or those who come to interact with these children, as I have said regarding fever, these children may not